Good evening. Welcome back to our session this evening on Health Talks. And February is Heart Health Month, and so that's going to be the topic of today. I welcome back Dr. Poulos, who is a primary doctor with Advocate Sherman, serving our area, as well as Elisa Lara from VNA Health, a nurse at VNA Health. And so we welcome you this evening, and then I am Martha Martinez, the Social Services Manager here at Gail Borden Public Library. Okay, we are having a little bit of change in programming and how we're going to do tonight's session. We're going to be recording in English and in Spanish separately, so please look for each of the recordings. They'll be published as to when they will be available. And that is the plan going forward, hopefully, if this works out well. So tonight we're going to be focusing on cardiovascular disease. We're going to be talking about symptoms, risk factors, and prevention. And then at the end, Dr. Poulos is going to share with us the update from King County Health Department on where we are with respiratory illness in the area. Okay? So I wanted to start out by just sharing with you that some of the national statistics that we see, and they tell us that 1 in 3 people will die from cardiovascular disease. That's 859,000 people. And again, much of this is preventable, so I think this is the purpose of our call our session this evening. And so, what impact does it have on the health care system in terms of costs? There is an expense of $260 billion per year on health costs as well. So again, something that can be preventable or reduced. And then last but not least, in lost productivity, we will see about $147 billion in loss in premature deaths from people. So when I think about it, 1 in 3, I think about we sitting at the table, it's saying 1 in 3, or
one of us,
one of us, right? Or when you gather with your friends, that's what the stats say today. So the purpose of this call is to share information with you and hopefully get you to change habits so that we can
raise sure we make
right?
better choices.
Because
Absolutely.
That's the whole purpose of the focus on heart disease this month.
And that's ideal because I think, just thinking about different changes that you can do on a daily basis, even simple as drinking water instead of pop. And so all this is really important because it makes you think, what can I change to make my risk be reduced?
Dr. Poulos, I wanted to ask you, could you give us a basic definition of what cardiovascular disease is?
Well, there's a difference between cardiovascular and heart disease.
Okay,
heart disease includes several types of illness that are not part of the circulation of the heart. There can be problems with the heart valve. There can be problems with the heart as being a weak pump.
Okay.
But I think that today's session we're going to mostly focus on cardiovascular disease. In other words, illness that stems from poor circulation to the heart. The heart has arteries. They're called coronary arteries because they look like a corona or crown on top of the heart and go around. And those arteries feed the heart. So that's what I think our focus is going to be more on. But to keep on in mind that there are congenital heart defects. There's people that develop a valve problem, which is also the heart, but not exactly what we're going to be focusing on today.
Okay. And Elisa, can you tell us what the risk factors are?
There's so many, but I think some of the most common ones are actually like high blood pressure. That's something very common, and a lot of it's
very common.
Yeah,
right?
And sometimes you have it and don't even realize it. So if you don't get checked, don't even know that. So
that's a very important observation, that I think that because so many people don't feel different, they're not even aware, and it's important to just do your yearly checkups and make sure that you're not developing high blood pressure.
Absolutely. Cholesterol, when you have high cholesterol too, and you don't even realize that, if you don't get checked, it's not like you have symptoms of having high cholesterol. So that's another one. Diabetes, smoking, that's terrible, because it's, even if you're not smoking yourself, but if you're exposed to it and you're in a room that's, you know, secondhand smoke is really not helpful at all. Obesity, and right now it's so easy to gain weight, especially with these climates we've had. I'm like, it's so easy to have like the chocolate cup of milk and
all the
warm,
of the
you know,
season.
las conchas and stuff like that.
Well, it's hard to get motivated to exercise when it's -30 wind chill.
Absolutely, yes.
And
so
when the days are short,
yes,
you know,
there's no sun. It's gloomy outside, so you really don't have that motivation.
Yeah, but I have some suggestions or strategies for that, but that's definitely, and the same thing happens to us here in the northern climates in winter, is that you tend to gravitate more to the foods that are starchier, a little bit more fatty containing, just to
it just feels good. It's not good for us,
so,
but
there's some strategies or way to think around that, I think.
Good. We'll need to take notes. I have to make sure.
It's
but
hard,
I mean, having an unhealthy diet, and you know, it's so easy because it takes preparation to be healthy, right? And sometimes we don't have that time. When we're rushing and we're running, we go quickly to the fast food restaurants, which is not helpful. So I think that's another risk factor that we actually do on a daily basis. You know, our drinks have high sugar, you know, so that helps us increase diabetes, and that's not good. So unhealthy diets, you know, which is something so common. And I think these are all different.
We live in such rush times that people don't have time to do meal preparation like we used to in the past, or we maybe don't have a stay-at-home parent that can, you know, begin all that prep work ahead of time. And I think those are the things that maybe for us are more challenging in these days, right? So it really should focus on ways of working around that and working around that.
I think that there's, in terms of improving, and what I like to tell my patients to give them encouragement is, for all these risk factors, they kind of intersect. So if you're working on one, you're working on the others. So if you're trying to work on a healthier diet for blood pressure, you also can very easily include in that fewer fatty or sugary foods as well. It all sort of overlaps, so people don't have to feel overwhelmed by it. I find that the time pressure leads to some bad choices, but also it's a financial thing. There's the term food deserts, and the fact that unhealthy foods are cheaper and often easier to find. And there are some neighborhoods, for example, like there were years where the northwest side of Elgin did not have a grocery store, if you remember, or that even people that can get to a grocery store, the less expensive foods are oftentimes the hot dogs and the mac and cheese and the things that aren't necessarily the healthiest. So to think of ways around that. In terms of convenience, I think that the grocery stores I see are trying to make some efforts to make it a little easier for people, like the salads that are already in a bag, already cut up, or meats, or like you don't have to buy and cook a whole chicken. That it's already, you can just buy some chicken breasts if you want. You know, so there's both time and money are impediments.
And that's an interesting thing, because when you have that hunger pain, you know, you just want an immediate meal before you, and it's going to be easier to just go and pick up something than to go grocery shopping and then bring it home and start cooking. So you really kind of need to plan around this to start a healthier lifestyle. That's exactly right.
Well, I think this is a good time of year, though, to be having this discussion also, because it's after the holidays, and it's almost ironic how many people join a gym or do something after the holidays, and then they lose their.
Let's do this.
But then they lose the motivation because it's a big task. And if you can make it into small little pieces, like you say, not that you say, well, my New Year's resolution is to go to the gym every day and lose 20 pounds. Well, maybe your New Year's resolution can be that I'll have a salad for lunch several times a week. I mean, something that's a little more doable. Pick something doable so you don't get discouraged, but that is a step in the right direction.
That's a good point.
Even like just carrying a water bottle with you, because like right now we don't feel like we're thirsty, but we really do need it because our bodies do dehydrate. But just making that habit of carrying a water bottle with you, you'll be more up to drinking more water, which is going to be helpful, and it's going to help sedate, you know, and hydrate our bodies.
And it sets up a good practice as well, even especially for like summer months when we do dehydrate much easier.
The
Very
thing
good.
Is, the good thing, kind of the bad thing, but the good thing about these risk factors is that when you start working on one, it motivates you to start working on the others. And they're not in conflict with each other. In other words, trying to work on diabetes will work on the obesity. You know, so for some of these things, you're quite right, though. It's diagnosis. I'm amazed at the number of people that don't even know they have diabetes. When you ask them, and they say, "Oh, yes, I do." You know, if you find that you're running to the bathroom all the time or you're thirsty all the time, that's a symptom, but people don't realize it. High blood pressure is quite silent, and if it's bad enough that you're getting a headache, I'm really worried about you. But you know, so if you go get checked, you'll find it before it's giving you a headache or a heart attack or a stroke.
The one thing that I see was a lot of our patients that start going and you know, are frequently using the bathroom, they think I'm getting older and my bladder's not working.
Weaker.
So they blame, they blame other reasons and don't really feel like they need to get checked, which is something like, well, you need to get checked. And sometimes it's just that they're diabetic and they don't even realize it because they kind of blame getting older, things are going to start malfunctioning, you know, and regardless,
well,
we need to make sure we go check.
But a way of thinking about also the physical inactivity for those of us that live in like the Elgin Park district, the walking track at the center is free. So even though people might not either have the money or inclination to join the gym part of it, which is not free, to go up to the walking track, and I think the hours are very convenient, early in the morning till like in the evening sometime, I believe it's 5 a.m., 9 p.m., something like that, that you can go and walk around, and there's 2 lanes for slow people and 1 lane for fast people, which is about right.
Turbo right at the end.
Yeah, I stay in the slow lane. And so that's one thing that's right there, then and there, for as an option for people that are just can't or really don't feel it's safe or don't want to even think about doing an outside exercise at this time of year. So there are options, and there's even simple options that aren't daunting and aren't even that expensive.
Okay, well, and we've already spoken of some of the symptoms, you know, frequent urination, a headache, things. Doctor, what are some of the other symptoms?
Well, that's actually symptoms of the risk factors, but if we're talking about the symptoms of actually
heart disease.
Well, that's trickier. What people call a heart attack is a colloquial term. It means that there's an area of heart that's being endangered or dying due to poor circulation, due to lack of circulation. And before the area is actually dead, it is in pain, and our body signals us that something is wrong with some type of pain. But the pain is unusual. People think about a muscular pain, like if you twist your ankle, that kind of pain. It's not that kind of pain. And it also varies with women tend to have more atypical symptoms. Like I think anyone that watches enough TV and medical shows has heard some of the symptoms, but I'll say them anyway. A chest pressure or discomfort, people describe it like an elephant sitting on my chest. Not like a sharp pain, not a stabbing thing, a dull ache or pressure, shortness of breath, the nausea, that discomfort here going to the left arm or the jaw or the upper back. Those are all things that are symptom perhaps of heart disease. If the heart is actually pumping poorly, for example, if there's already been a silent heart attack or if hypertension has strained the heart, you might get some swelling in your legs or ankles, or wheezing from a buildup of fluid in the lungs, a sensation of palpitations or a fast heartbeat. In women, because it's really harder to diagnose a heart attack in women, or for them to know that they have to go to the hospital, because it can be very atypical. It can just be some fatigue with exercise and not this classic chest pain. So that's why with women and heart disease, you have to emphasize to people that the symptoms are different. And what I really like to emphasize to people is that certainly the first inclination might be to call your primary doctor, and that's fine, but it's not the best plan to go to your primary doctor's office if you're having these acute symptoms. Your primary doctor can check your vital signs, probably can do an EKG in the office, cannot do any of the blood tests that are needed, and does not have any of the medicines that are needed acutely. So if you're having these symptoms, probably the best course of action is to go to the emergency room.
And that's great advice, doctor, because I think you're right. Time is lost, right? When you go in.
And I sometimes have people that get annoyed when they call in with these symptoms when we say go to ER, and they're like, well, can't you just check me out in the office? Well, of course I could, but it's not the best place.
Right.
And oftentimes it causes an extra delay.
Yes.
And an expense to the patient, because I say, nope, you know, they come to the office and I say, nope, you have to go to the emergency room, and I call an ambulance. You know, your doctor might call an ambulance, and then, so there's a built-in delay. So with these kind of symptoms, when in doubt, ask. Now, the other situation is that I have patients that are feeling great, but maybe they took a long bike ride a week ago and they had a funny feeling, and finally their spouse has talked them into calling the doctor about it. Because that's another thing, denial. People don't want to admit that they might feel funny. No one wants to be sick. And so if someone calls and has had a funny symptom weeks ago or something unusual that they think might be hard, that might be a situation that's appropriate to go to the doctor's office instead. But if you're in the middle of something, or if you have had repeated episodes of chest discomfort or these other symptoms for several days, the best thing is to go to the ER.
I think one important thing is to know we don't have time to consider should I go or not, because time is crucial. Yeah. So if you are having a heart attack, you don't want to wait around. Yeah. Mm-hmm. So I always say, if you're in doubt, not sure, just go to the urgent care, because you know that you'll get the right testing.
And I think people
say, well, I don't want to waste the ER's time. It's like, no one in the ER thinks you're wasting their time if you show up and you say you have chest pain, chest discomfort. That's like what
that's who's supposed to go there.
No one's like, well, what are you doing here? No
Not
one
for a
does
cold,
that.
but for that, yes.
Yeah, and I think people have, the preconceived notion of what a heart attack is. It's like, something sudden, something that happens right away, and it's something massive. And sometimes it's not the way. It's happening over time, over hours, and that's why your point of just go and get it checked out is important, because time is precious. You don't want that heart to sustain more damage.
In our area, we have really 5 local hospitals in the whole broad area. There's no reason to not go.
Yes, that's Elisa, so now we've talked about risk factors, we've talked about symptoms, and of course the focus on the month is prevention, right? Mm-hmm. So what are some things that we can do?
Well, we talked about like diabetes and hypertension. How do we keep those under control? That's something that we need to make sure that we have been diagnosed with either one of those. What measures do we have to take? And I think it's important to make sure we exercise. That's ideal. And any little movement, we could start slow. We don't have to go run a 5K right now. It's just walking at a good pace where your heart is elevated and you feel that circulation and breathing. Have you ever done exercise and when you're done, like you feel good, you feel like you breathe and you oxygenate, even just taking big, deep breaths make your body feel much better. So imagine when you're helping circulate that, I think it's really important and ideal. So that's something, eating a healthy diet. I think it's so easy that we go to the side that we shouldn't and eating the bad stuff, and later on you feel sluggish and you don't feel good. But when you eat the healthy diets, salads, having our good proteins, you even feel like lighter, and it's easier to move around and you don't feel so sluggish. And that's something that our bodies are trying to work with what we're feeding it. So if our diets aren't that healthy, our bodies start struggling, and that's something that's really important. So try to keep our bodies in a healthy weight. I think that's ideal. Making sure our drinks, it's so easy how we have consumption, a huge amount of consumption of sugar in our drinks. I mean, if you think about how much we're having in our drinks, our carbs turn into sugars, so that's not good either. So really be conscious about what exactly we're having. Alcohol, I know sometimes we feel like we really need it, but honestly, ideally, take it easy. Go work out instead of relieve that stress that way. Yeah. But alcohol consumption does have a factor, and it's not ideal. So
and it's actually, some people are shocked when they hear the recommendations for alcohol consumption are for women no more than 1 drink a day, and for men no more than 2. People are like, really? Yeah. I have that before dinner. And so, I try to send them
so you can't have 3 before dinner.
We're talking about the ideal. The other thing that I encourage my patients as far as prevention, all of the things you discussed were lifestyle, but medication plays a role. I have 2 extremes in my practice. One extreme that doesn't want to do any medication, they want to do it all with lifestyle. And sometimes they truly try their best and it's just not enough. you need medication to help. I have the other people that want to keep having the same really bad lifestyle they've always had and take a few pills and make it all better. That
magical pill that makes you
and that doesn't do it either. It has to be a middle ground, that you work with the medication, but that don't be resistant to medication. And taking a medication for cholesterol or hypertension doesn't mean you failed. I have people that are very despondent because they've been on a very strict diet and their LDL or bad cholesterol is still very high, and I point out to them that it could be also partly genetic, and that you're doing your best and you need a little help. What's wrong with that? I mean, that's why we have medications. Why live in the modern world? So,
and that's very helpful.
So a combination of having a balanced attitude. Work with the medication, but be open to them.
Right.
Some people are very negative about, I don't want to take
pills. I think if they're scared because you think about what you're doing to your liver, and then they have that concern, is this something that's going to make me addicted? You know, but if you don't take it, like they feel like, oh, if I take it, I'm always going to have to take it and it's going to be harming me instead of helping me, and that's not it. If you don't take the medication, it'll actually harm you because your cholesterol is going, you'll have a heart attack. So I think you gotta weigh things out because they get concerned.
I think it can also be a motivation to think that for some people, obesity is a big underlying factor, and if they're really going to work on the obesity issue and lose a significant amount of weight, and it doesn't have to be humongous, but it could be like 10% of your body weight, you can probably get rid of a couple of your pills. And I find that to be a motivator.
Even changing our diet, that'll change a lot of your weight as well. Just as much sugar as we drink in our drinks, that in itself, I see how people can lose weight so easily just with something so simple.
Yeah,
definitely.
Very good. Good. Well, good. I'm hoping that we've shared lots of good information with you. When we stop and think about what do we do? What facilities do we have here in the area? Of course, as always, we always recommend that that people do their regular checkups with their primary doctor. If there is a recommendation from the primary to go to a specialist, well then go ahead and follow up and do that. Don't put it off. And of course, if you're feeling any of the acute symptoms, just as we said right now, go have it checked out, because you don't want to sustain that permanent damage to your heart. So as you said, doctor, we've got 5 facilities here in the area. We've got the 3, we've got Ascension, St. Joe's, we've got Advocate Sherman, we have also Alexian and Hoffman for the people on the east side. We have
Huntley,
there's Huntley,
there's the old Delnor, Northwestern Delnor. There's resources, and people start with your primary doctor. And one of the ways we're also lucky in our community is that we have several federally qualified health centers. So for people that are of low income and maybe for that reason are not able to easily access private practice, physicians can go to a federally qualified health center where there's a sliding scale that is really goes to a very low amount.
But even that, if they can't pay, that's not a reason why not to get checked, because they'll never turn anybody away. At VNA, they say, you know what, if you're not able to make a payment, which is the minimal, you can make small payments of $5. If that doesn't work, you can always write a letter. But what's ideal is that there's funding to help, that nobody should be turned away because they can't afford.
Exactly.
If someone feels poorly, but not poorly to the extent that, like we were talking about, chest pain, shortness of breath, palpitations, but just people kind of know when the body's not right, or sometimes you feel good, but you say, I'm 40, maybe I should get checked out,
Yeah.
A lot of times people
have a routine screenings that we need to be doing. And
or someone they love had a heart attack and it gets them thinking, well, maybe I should be checked, But maybe if they're having financial difficulties, there's options too.
And we're very fortunate to have 2 federally qualified health centers here in our area, both VNA, where Elisa is at, and also Greater Family Health. So we should leverage and take advantage of the fact that we're funded for both of those services in the area. I think it's a great idea. Okay, well, I'd like to maybe just wrap up this portion of the conversation and transition over here to the section on covering respiratory illnesses here in our area, and I'm going to turn it over to Dr. Poulos to share with us the information from Kane County Health Department.
Yeah, I was going to share some information, and in fact, I apologize, possibly this should have been discussed a little earlier on when we were talking about statistics, but the leading causes of death in Kane County, number 1 is cancer, but a very close second is heart disease. And in fact, if it's looked at by ethnicity and race, heart disease would be second for non-Hispanic, white, and black people, but number one for Hispanic is heart disease.
Wow.
So,
and I think many times you don't realize it.
yeah,
you know?
so that's, in terms of statistics, it's, that's a pretty important thing to be aware of. Now, looking at some other statistics that I obtained from the county, there's a slide that kind of looks like this, that shows, it kind of gives an overview, honed down on the last few weeks of last year, first few weeks of this year, that you can see there was a little spike, not surprisingly, right around the holidays, with the three big respiratory illnesses, influenza, COVID, and RSV. In fact, there was a time right around New Year's that I was getting 3 to 4 phone calls a day with people, luckily self-testing themselves and getting and being knowing they're positive, so they don't go to parties and infect their whole family. These illnesses are still there. COVID's not over. Influenza we've had forever, and RSV we've actually had for a long time, but only relatively recently realized affected adults as badly as it does babies. So there's 3 respiratory illnesses, and depending on your age group, you might qualify and be appropriate for vaccines for all 3 of them. Why miss time from work? Why be sick? Why potentially die from something that you can prevent? These vaccines are available in every pharmacy. Depending on the doctor's office, some offices only will have influenza, won't have the other 2 vaccines, but they're out there, and there's no reason to be afraid or avoid the vaccination. If you think you have a reason not to be vaccinated, discuss it with your primary doctor. Maybe your concern is valid, and maybe it isn't. You don't know. But we're not done with COVID. COVID's not done with us. And these other 2, influenza and RSV, have been around for a while. So the sooner I think that people accept it and protect themselves, the sooner we'll have a healthier winter and more fun holidays than people sort of having to miss all their holiday parties because they were homesick with COVID.
Exactly. And now that when we're finally going to catch a break into this really frigid Arctic weather that we've had, let's be healthy about it, right? And we've got just like another month and a half or so, and then we'll be able to be outdoors more and that sort of a thing. So if you've made it this far without getting sick, make every effort to just, continue what you're doing and be careful and safe and
get rest.
And get
sleep.
rest.
Sleep is
Sleep
important.
is
your
important.
body's recovering.
And if you have the sniffles, don't go wherever. I think there's been an improvement in the attitude of employers to their employees. It used to be, you have a cold, just suck it up and show up to work. And now people understand that if you have a respiratory illness, you really shouldn't go to work.
Yeah,
and
that's how it spreads.
Everyone else.
Right? Yeah, exactly right. Okay, well, thank you for accompanying us this evening, and we will be working on our 2024 schedule, and we will be publishing that information. Please look for that information in our newsletter and anywhere else, probably in comments here as well. We will be working on that, and we invite you to come back. We hope you like this format. If give us feedback. If you don't, if you prefer something different or prefer the older format, we're experimenting here with the start of the new year and see what works well. In any case, on behalf of all of us, thank you and have a great evening. Bye.
Bye.